Facing a surge in coronavirus infections, European Union leaders are discussing a proposed law to block exports of COVID-19 vaccines made in the bloc. The two-day summit in Lisbon comes as many member countries face vaccine shortages. British-Swedish vaccine maker AstraZeneca says that it'll only be able to deliver half the amount of injections that it had pledged to the bloc for the first quarter of 2021. EU officials have also sparred with their British counterparts, blaming London for hoarding vaccines. But on Thursday, both sides said they're making efforts to reach a win-win solution. Other world leaders, including US President Joe Biden, are also attending the summit virtually to discuss a unified response to the pandemic.
Health diplomacy is now central to a modern European foreign policy. Since the early months of the pandemic, we have worked to shape a European approach to health diplomacy, and it is based on two pillars. First, team play, and second, we're in for a long haul.
For more on this, Pieter Cleppe joins us now from Brussels. He's an EU policy analyst and editor-in-chief of the Brussels Report. Great to have you back with us, Pieter. Now, the pandemic is expected to dominate this EU summit that's underway virtually and in Lisbon, and that's understandable given the scale of the crisis. The European Commission has proposed blocking shipments of vaccines produced on European Union soil. How is that idea likely to be received by the EU leaders there? Will they approve it?
Well, it's quite something indeed. For months, the President of the European Commission, Ursula von der Leyen, was warning about vaccine nationalism and was urging to work together internationally. And of course, she's absolutely right there. But then she has made a U-turn recently, indeed, pushing for what I would call vaccine protectionism. And this is because it is getting a little bit embarrassing for the European Commission to see how other countries, notably the United Kingdom, Israel, and the United States, have secured a lot more vaccines than the EU. Now, the governments of the European Union are not, let's say, overly excited about this. They are split. Germany, France, Italy, and Spain support these protectionist measures, or at least the sharpened up framework that would allow this, while the Benelux, so Belgium, the Netherlands, Luxembourg, and Ireland are countering this. I think some kind of a compromise may be found, which would involve sharpening up the vaccine export restriction mechanism on the one hand, but on the other hand, agreeing politically that it won't really be used.
I guess in order to support President von der Leyen's proposal, she tweeted that she had told EU leaders that 62 million vaccine doses have been administered to citizens of the EU, while 77 million have been exported. So clearly she's making the argument that the EU has exported way more doses than they've actually administered. Do you think the governments of the EU will, I guess, listen to an argument like that and support the European Commission's proposal, or will they simply blame, say, the European Commission itself or even the drug makers?
Well, to a degree, the German government supports this. Angela Merkel has said that she's not in support of general export restrictions, but then she supports clearly specific export restrictions. And I think that's incredibly short-sighted because indeed, even if you would sort of go with that logic, despite the fact that, of course, these EUs are not owned by the EU, but are basically paid for by countries, sometimes outside of the EU, and that are expecting a delivery. Now, even if you would go with that, and if you say, well, we don't care about respecting contracts, we only care about getting our hands on as many vaccines as possible, I mean, even then, it's not an intelligent thing to do. Why? Because these are global supply chains. Other countries, notably the UK, Canada, the United States, they could retaliate, and they could. It's true that they have not been exporting vaccines to the EU, but they have been exporting ingredients and essential components of vaccines. So in a few weeks, their export restrictions would be able to stop vaccine production here in Europe. So this vaccine protectionism, vaccine wars will ultimately hurt vaccine provision to Europeans.
Now, this pandemic has been European Commission President Ursula von der Leyen's first big test since she took office in 2019. Obviously, this is a crisis that's a difficult one for anyone to manage, but she is the figurehead of the European Commission, and the European Commission's vaccine rollout has been heavily criticised. How much responsibility should she bear for what's been seen as quite a bungled vaccine distribution?
Well, it's hard to deny that she has been responsible indeed. Clearly, one of the problems was that the people involved were very expertised when it comes to trade matters, but that they apparently did not know enough about big pharma. This, for example, in contrast to the UK, where the chief negotiator was somebody who had excellent links with pharma companies. Now, it's one thing that the European Commission messed this up. I mean, it was not easy for anyone. And of course, you have 27 countries to reconcile. But then it's another thing how you respond when you see that there have been failures. And first, Ursula von der Leyen tried to blame her trade commissioner. She also tried to blame, of course, these pharma companies like AstraZeneca, claiming that there had been breach of contract. But then when the contracts were announced or made public, since then the European Commission has not taken any legal action. So I would think that therefore they don't really have much of a legal foot to stand upon. And of course, this is like sort of the desperate last act is to try to resort to protectionism.
Okay, Pieter Cleppe, we'll have to leave it there, but thank you so much for joining us again from Brussels.